Well, a local man spent just 1 hour in the emergency room and then got a bill for more than $7,000, even though that hospital was on his insurance plan.
Courtney Garris joins us now with more on the health care loophole that's blindsiding patients with big bills. Courtney.
Carol and Steve, it's called drive-by doctoring. Surprise charges for medical care that can be 40 times the regular rate. A Mount Pleasant man called for action after this happened to him, sharing his story as a warning for all of us.
Couldn't stop it. Had spit that out, had another mouthful of blood.
Randy Lound was watching a movie with a neighbor when his gums started to bleed, a complication from having his tooth pulled.
In a little over 2 hours, I lost over 3 pints of blood.
He was taken by ambulance to the closest hospital.
The doctor just couldn't get it stopped.
So a local oral surgeon was called in. He cauterized the vein and put 30-plus stitches in Randy's mouth.
The whammy was when I got the bill.
That oral surgeon charged Randy $7,614 for his services.
You're out of your mind. That's an unbelievable amount of money for an hour's work.
The hospital where Randy was treated is in his insurance network. The oral surgeon is not. What is $7,000 plus to you?
Basically like buying a car.
It's a practice known as drive-by doctoring, hospitals and clinics using specialists or surgeons that are out of network.
It is the patient who is the ping pong ball.
Marquette law professor Allison Barnes says the disconnect comes when there's no contract for service between a medical provider and insurance company.
This is already a doctor who has not agreed to be part of network. So they are by definition a high-priced doctor.
Meaning they can charge whatever they want. In Randy's case, insurance agreed to pay what it felt was a reasonable amount for the service, around $2,500. Randy is now stuck in the middle, with the surgeon trying to collect the balance of more than $5,000.
What I'm afraid is going to happen is it's going to come back on me in the way of a lien.
Randy's on a fixed income and says there's no way he can afford that bill, which is now 120 days past due.
People have got to know that this is something that can happen to anybody at any time.
Well, some good news in Randy's case. His health insurance company is now working with the oral surgeon, so Randy won't have to pay. But Randy says he's still nervous that in the end that bill might come back and he'll be stuck with it.
Okay, you're a patient. How do you protect yourself from a doctor coming in the room and doing work on you that is going to be super expensive like this?
There's some things you can do, but in an emergency situation, you're kind of stuck. Current laws do not require hospitals that join an insurance network to always provide in-network doctors, labs, x-rays. As a patient, you have to be diligent, talk to your provider about your care, who might be involved, and ask for only in-network services. Unfortunately, like I said, when it comes to a medical emergency, like what Randy went through, there's really not much you can do, except in the end, you try to negotiate that final bill.
Yeah, you just want to get fixed. That's just unbelievable. Well, thank you for alerting us to this, Courtney.
Thanks, Courtney.